Everyone. Welcome to tonight's meeting of the Health and Social Care Review Group. If I just go through the admin stuff first. This meeting will be live streamed to the public, and a recording will be available on the council's website within 24 hours of the meeting. If officers joining remotely, if you could use the hands up icon on the screen for questions and comments. In the hall, if you can turn your camera and microphone, turn your camera and microphone on when speaking off when finished. Anyone in the hall, please remember to switch your microphone on when speaking off when you finish speaking. Speak directly into the microphone. Switch off mobile phones or place on silent mode. Okay, any apologies for absence?
Yes, Chair. Apologies from Councillor Chowdhury, who's going to be subbed by Councillor Yaron Begum, and also apologies from Stephanie Power from Health Watch.
Thank you. I have apologies from Councillor Mead. Okay. Minutes of the meeting of the 27th of February 2024. I think that's those of us who were there. Are those minutes okay? Minutes of the meeting 21st May 2024. I presume those are okay. Any disclosures of interest?
None that I'm aware of, Chair.
Okay, no urgent business.
None, Chair.
References from committees and other bodies.
Again, none, Chair.
Okay, I have nothing to report on anything that's happened since the last meeting. Just like to say, just to put on the record, thanks to everyone who's served on this committee in the past year, and welcome to anyone who is new to the committee this year. Okay, if we go on to the first and only item, the report on the drug and alcohol treatment procurements. Just to note that we are recommended to support that Luton Council complete full commission of the drug and alcohol treatment and recovery services, and that the new services will be commissioned as per the detail given in this paper. Sarah, is it Sarah who's going to present the report?
That's me.
Okay, go ahead.
Okay, good evening. My name is Sarah Pacey and I am the Commissioner of the Drug and Alcohol Services in Luton. And as per the paper that we've shared with you, we are intending to recommission the drug and alcohol services. Can you hear me okay? Yeah, we're intending to. Okay, sorry, that was a confused look. I couldn't tell whether you could hear me or not. We are intending to recommission the drug and alcohol service. The current contract ends in March 2025. We have taken the paper and the new model through the various boards, and we're coming here just to inform you of what we're doing and to see whether you've got any questions for us. The reason that we are going down the full re-procurement is we've had to change some of the current spec. The spec that our current provider is working on is a real over specification. It's all singing and it's all dancing and it covers everything to do with drug and alcohol. And our provider has struggled to deliver on some of those elements. So currently the contract covers drug and alcohol treatment for young people and adults. It covers prevention, training and recovery. That is when someone's left treatment, how they maintain their world and their life without going back to drugs and alcohol. So what we're intending to do is we haven't got any further funding, so the financial budget is remaining the same. So what we're going to do is we're going to have a smaller spec with a smaller financial envelope for drug and alcohol treatment. So that's where people will go if they want to stop and are able to stop drinking and taking drugs. And then we're going to have a separate recovery service. Now, evidence tells us that it's better to have an independent recovery service rather than it being tied up within treatment, because some of that work can be really long term. Some people need to have that recovery support for the rest of their lives to stop them from starting to use again. So it's that kind of service that will reintegrate people back into training, back into work, get them to close off ties with their families that have been broken down. So in the future, we want a smaller clinical model, a treatment model, where people will have one-to-one work on reducing their drug and alcohol use. Then we'll have a recovery model for when they've come out of treatment that will help support them to keep and abstain from substances. The additional part of this model will be a support service that we're having. We know evidence is telling us in Luton that we have a large cohort of people who have really got entrenched drug and alcohol issues. They're sort of like quite old now, and not only have they got drug and alcohol problems, but they've also got lots of mental and physical health problems as well, and they're difficult to engage with. Some of them, we believe, have got acquired brain injury, which is due to alcohol consumption. The alcohol has an impact on their cognition. It may be where they've got into fights and have hurt their heads. It may have been when they've fallen down. And some of that cohort really aren't ready for treatment. They need a different type of care. So we're going to look at commissioning a service that walks alongside people. So it will support people whilst they're in treatment, take them to appointments, try and take them to get their mental health problems sorted out, get appointments with GPs, and then we'll have a recovery system as well. So we are hoping we're going to do it in a way that we are procuring 3 lots, and what will happen is they will become the Luton Drug and Alcohol Alliance, and they will work together and be performance managed together as well, because they all need each other to interconnect to get people through treatment. So we're going through, we've got a timeline that's on the report that I sent through to you, and we're on time with that report. We've taken the new model out to consultation, and we've had some really positive feedback from it. And that's really where we're at the moment. We are just getting the spec ready, and we're having some provider days in July, and there's already been a lot of interest already from treatment providers who would like to in-reach their services into Luton. So that's it in a nutshell. We're recommissioning, we're changing the model a little bit. There are no financial changes to how much we're spending on drugs and alcohol. We're just splitting up the huge spec that we've got at the moment to give 3 different independent services the chance to deliver in Luton, rather than it just being one service delivering everything.
Okay, thank you, Sarah. Does anyone have any questions, comments? Councillor Begum.
Thank you, Chair. Thank you, Sarah, for the report. I have 2 questions. The first one is, you talked about you will provide them support. Can you give me an example? Just use someone, a Jane Doe, give me an example what that looks like. So you said they go to, if they're in treatment, so just give me an example of what that looks like, please. Because I couldn't see that in the reports. Just choose someone, just use my name and give me an example. If I'm in recovery, how you will help me.
Okay, so there are different elements to this. We're going to have the treatment model, and that is where you would go on working to reduce the substance that you're taking. People are normally in a 12-week programme, and they work with psychologists, key workers to reduce the alcohol or drug intake. When that is completed, they should go, if needed, into recovery, which is a different type of intervention. That's where you look long term on how you can maintain your life without taking a substance. So there's going to be a treatment service and a recovery service. So you'd be in treatment for a little while, working with clinicians. And then you would go, if needed. Some people don't need to go into recovery because they can just walk back into their old lives. But some people who have lost contact with family, they've lost their job and their housing, they need more support. They may need someone to take them to appointments. They may need to really start up their own social network again, doing things. Because when people fall out of treatment and they haven't got that recovery support, that's quite often the number one reason why people end up using again, and then they're back in the treatment system. So we want a really good clinical model to help people and support them to withdraw their use. Then we want a recovery model that helps them to maintain it. The new part of this model is the support service. And that's to handhold people. So people that perhaps you see outside in the town centre who are street drinking, that are not engaging with services, that support service would do outreach with them and try and work with them to get them into the support service. Years ago, I worked in drug and alcohol and treatment, and what would happen was you would get some goals or working with somebody and some aims and say, I'll see you in 2 weeks' time. And when they came back, they hadn't done any of their goals because they couldn't understand what they had to do, or they didn't know how they contacted their mental health provider, or they didn't know how they could go to the town hall to have a look at their housing. The support service will be a real hand-holding service that intervenes and walks with that person to take them to all the appointments and all the places where they should be. And hopefully, if we can get the problems that are surrounding this person sorted out, we're hoping that will reduce their drug and alcohol consumption. Because we all know that drug and alcohol consumption is a symptom of a problem. There's something else going on. Why is this person taking drugs? Why is this person drinking so much? So the support service would be looking at how can we work with this person to bring them through treatment and also take them through into recovery. And it's really important that we have those three lots and they work together. And what we're hoping is there'll be a completely new IT system and case management, so people won't have to retell their stories all the time to different providers. So people will seamlessly go into treatment, perhaps be supported by the support network, and then back into recovery if needed. So there are lots of people, I think, that would in Luton, because we've really thought about the issues that we've seen over the past 7 years with the current contract. And what we can see is there are a lot of people in our current provision who really shouldn't be in a treatment service. You know, they need a different type of support and care. They're not ready for drug and alcohol treatment, and that support service that we're commissioning will hopefully handhold them and support them. Because what's happening at the moment is we've got a lot of people in our treatment service that aren't ready to engage with treatment services, and it's making a bottleneck. So when people are knocking on our provider's door saying, I'm ready to do some work and to reduce my drug and alcohol intake, there's a waiting list because of this bottleneck. So what we're trying to do is to separate the services. So we've got one when you're ready to engage, and another service, the support service, that will work with you to help you to get to that place where you are able to engage in drug treatment. And then the recovery will be independent. The recovery system will be there after you've come out of treatment, or it may be there are people in the community now who are struggling but don't need to be in treatment, but they do need some help and support to get their lives back on track. So it will be open to all residents in Luton, not just those in treatment. I don't know if that's answered your question, though. Does that make more sense?
Yes, it does. Thank you. It answered part of it. I was focusing more. You did cover some of it, the challenging ones, the ones that you are not able to reach out to. I think you talked about people who are on the street, and if you, my ward Central, which if you go to Elizabeth Street, there's people on there, there's needles and things on there. So my questions are around those difficult people that we can't reach out to. So on the, which one do they put in, lot 1, lot 2, or lot 3? If they are not engaged in any of those 3, what do you do then? Is there any way of getting them engaged in the service? I mean, resolution do a lot of work, but there's a lot of backlash of people who are in resolution. They get the medication from there, they sit in one of the sheltered accommodation housing thing, and then they do their, so for me it's around those ones. Is there any work around that?
Yeah, and you're absolutely right. Those are the people that are working with Resolutions, our current provider, but they're not making any changes. So that's where the support service would come in to work with them. They're going to do assertive outreach. So they'll be actually working out in the streets, picking people up and trying to engage with them. Lots of these people that will be working with the support system will be people what we call, they've worn the T-shirt. They're people that have already had drug and alcohol issues. And what we know is those hard to engage people like that kind of support where they're talking to someone that's had the same issues. So all of the services will provide outreach, and it could be that at any point somebody is actually in all 3 of those services. They're getting some clinical support and a script from the clinical model. They're working with the support service to help them engage with their mental health service or go to see their GP or to get their housing sorted out, whatever the issue is. But they might have started engaging with recovery as well to try and get that long-term aspect of their life sorted out. So although there's 3 lots, they'll really be working closely together to put a circle round those clients, because we know that, like you've just said, we've got a really big cohort of people, especially in the town centre, who have got that entrenched drinking behaviour, and they're known to all the different services. What we want with this support service that we're putting out there, because we know there's a lot of services in Luton, is they're actually going to be out there working with them and engaging with them, taking them to appointments to make sure that they attend, trying to talk to them in a way that they'll understand and comprehend, because lots of them will have already been through these issues themselves. So we're hoping that this model wouldn't work anywhere else. This model is really for Luton and the issues that we know that we've got out there. And also we know alcohol brain injury, acquired brain injury as we call it. We think there's a lot of people out there that have got this in Luton, and part of the support model will be at the assessing of those people, because they need a different type of care, not drug and alcohol treatment, because some of them will not have the cognition to take on new learning. So we need to think how we can support some of those people. And we see them as we walk through the town centre, with their behaviour and things like that, they're causing a lot of issues. So we're really hoping that this new support circle around them will be able to engage with them in a different way, rather than just keep sending them up to the drug and alcohol treatment service where they're kind of in limbo up there and causing this bottleneck. What we need is there to be the flow, so that when people want to make changes, there isn't a waiting list. And we need to do this new support service is more about how we care for those individuals and find out really what the issue is. So really, people are going to have more of a choice in Luton now moving forward around what their need is. We're also going to have an open door system. So if somebody turns up at one part of the model, that doesn't mean you're going to have to go somewhere else. That part of the model will try and support them and handhold them into the other part when they see fit.
Thank you.
Councillor Isles, please.
Hi, Sarah. Thanks for the report.
Hello.
Can I ask, has this model been, is it anywhere else in the country? No. So how did you come about getting this model together?
From experience, really, I've been working with people with drug and alcohol issues for over 37 years. And this is something that we've often said when I worked in treatment, that we needed this support model. I've been in Luton for 8 years, and I can see how, when I listen to our provider and I talk to adult social care, mental health, the police, how we need this supportive model instead, because just because someone's got drug and alcohol problems, that doesn't mean they need to be in treatment. I know that sounds really silly, but it might be that they're just not able to engage. That, especially with alcohol, it causes so much damage to the brain that they're not able to take on new learning. So this support model is something that we've thought about, being here a long time, looking at our history, even prior to this contract, what was contracted before, and really having a look at our data and listening to what our partners have been saying about what the problem is. And this is where we've come up with this model. We have taken it out to consultation, both to service users who have consulted and said that they think it's a really good idea, and plus to our sort of like critical friends in Luton that are from other services. I've also taken it to Alcohol Concern and talked through the model with them, and they are really eager to find out how this model will develop. They think it's a really, really good idea, but we just need to test it out. We're going to sort of have a look at it for 2 years and evaluate it to see what the impact of it is, because I have a feeling if this works right, it will really impact mental health and housing, adult social care, because we have that steady stream of the same people that are going round these services in Luton that aren't really improving. And we see this model as really hand-holding and working with these individuals on a face-to-face, day-by-day process to really see what are the issues that are driving this drug taking and this alcohol consumption. So no, the answer is very clear that we are designing this model with what we know are the issues in Luton.
Can I just ask another question, please?
You can.
Also, so you spoke about being joined up with about the other services. So how are you going to make sure that you get joined up, and how are you going to measure those performance indicators when you are joined up, just to see, obviously, you know, obviously you might have you have a timeline for that, but how are you going to measure it, and when is it going to be measured?
So we're working on the measures at the moment. There are some measures that we have to have in when you're contracting a drug and alcohol service, like waiting times, exits, successful completions, representations. So we'll have to have them. Every local authority has to have those measures. With the support model, we're going to have much softer measures, because obviously these people aren't going through the drug and alcohol treatment system. Measures might be engaging with their mental health service. You know, have they sorted their housing problems out? Has there been a reduction in antisocial behaviour in the town centre? And I think it's going to be really individual, because we need to look at what the issue is coming in the door, and then look at what the measures are going to be for that individual, because everybody will be different. But they will be really soft measures. We've been talking to a couple of recovery services who are interested in the contract, and they were talking about a survey when people come in. How are you feeling? How is your physical health? How is your mental health? So we might be using something like that, but we're just working on that at the moment. Recovery will be different. I think it will probably be around numbers in numbers in recovery. But because recovery is long term, some people need recovery for a couple of months when they've come out of treatment. Some people will need it forever. It's really difficult to measure that. So I guess it will be around those numbers in treatment and how, again, they're feeling about their lives now they're moving through recovery. It could be, again, about how many times if they relapse, because we know drug and alcohol is a condition that relapses. And that's the beauty of this new model, is that the services, the alliance, as we're going to call it, will be all joined up. So if somebody falls out of recovery because they've started to drink or take drugs again, we'll be able to pick them back up and get them right back again, because it's kind of one model, rather than that person then having to go somewhere else and be on a waiting list. So Does that answer your question before I sort of like go off on a tangent? That's really, there are some measures that we have to have, and there are some measures that we are thinking about, but they will be very holistic and they will be down to the individual.
Okay, no, thank you very much. I look forward to seeing the progress of this. Thank you. Thank
So
you.
do I.
Councillor Nasser.
Thank you, Chair. Oh, hi, Sarah.
Hiya.
My question is about financial stability. I mean, because with my profession, I have experience working with people, a family who are drug users. But when they have a family with children and there is no, financial stability, that's make a huge problem to the family. So, I mean, I want to know how that, because I'm just giving an example. A couple of families when I worked with in the past, I mean, the mom has to look for jobs because she had pressure from the benefits that she has to stop taking benefits and blah, blah. But this has impact on the family as a whole, and also the client as well. So how your recovery can support that? Will they work with the service together, and how?
Okay, so there's a few things there. Thank you for that question. Firstly, I haven't really said a lot about families and young people, but our model will be supporting those who are impacted by somebody else's substance misuse. That's what we call our significant other cohort. So the services will be working with family members, children and young people who are living with somebody else's alcohol or drug consumption. So that family, that if we take that for an example, they could receive their own support from this model, even if the dad or the mum, whoever's got the issue, isn't engaging with the service. There are interventions and support groups that we are putting on that will support that family. In relation to the financial aspect that you asked about, we know that debt is causing a lot, and money and the financial world that we're living in at the moment is causing a lot of issues in Luton, and it's causing those anxieties that cause people to self-medicate and start to drink and take drugs. So within the support model, the new part that we're commissioning for Luton, debt advice will be available there. So that there will be two ways that family, if we use them as an example, could be supported by this new model, through financial support, and also from the family getting support from the treatment service as well.
Thank you.
Yep, Councillor Begum, please.
Yes, sorry for the confusion. There's two Councillor Begums here today. I'm just stepping in for another councillor. Okay, so I've only briefly looked at the papers and I kind of walked in as you were finishing your presentation. Although it sounds exciting, when do you think we could start getting figures in terms of measurements of the outcomes of these people? Do we expect them to be in this treatment centre for a long time, or what are we expecting? Because you talk about, if they relapse, we continue to support them, we continue to kind of work with them. Is this going to be like a lifelong cycle, or can we expect? That's my first question, and then I'll move on to the next one afterwards.
Okay, so drug and alcohol issues are a recurring condition, so we would always expect people to come back into the system. It sounds like it's negative, but for us in the drug and alcohol world, it's a positive. You've started drinking, you've started taking drugs again, but you've come back to the service. Evidence shows us that the more times that kind of happens, the spaces between that become fewer and fewer, and eventually you kind of sort yourself out. So it's actually positive that people come back into the system. In terms of treatment measures, there are lots of treatment measures that we could share with you at the moment about our current provider and how they are working with people and successful treatments, etc. But if you want to see the new measures, I'm guessing it's going to be this time next year, once we've recommissioned the new services and we have our first quarterly report after that. But we do need to be aware that when you commission drug and alcohol services, there tends to be a dip in performance where people kind of use the recommissioning of the service as an excuse to start drinking because they're getting confused about where they have to go, or they've got a new key worker. So we may see a dip in performance till we see it coming back up again when things kind of settle down. So I can provide you with measures now in terms of what our drug and alcohol treatment contract looks like in terms of measures. But for the new part of regarding the support and the recovery, that will be this time next year.
Can I just come in quickly? I think that's a really interesting question. So it's about when will we know that this is having a positive impact compared to where we were previously, bearing in mind how long people are in treatment for. So if they're in treatment for a year, the question is about, it will take a long time to know whether this is a better service, I guess. But so I was just thinking that through because I think it's really interesting. There are some measures that are shorter term that we will be able to see more quickly. So numbers in treatment is one. So we're hoping that our numbers in treatment will continue to increase because we've got quite a lot of unmet need in the population. So where they're not accessing treatment at all. So we hope that will increase because there will be more service options that are right for more people. And currently there are people that drop off the other side more quickly than they should. So we would hope that would stop as well. So the numbers that complete their treatment and don't just fall off or only come for a couple of times and then fall off. So I can't say exactly, but am I right, Sarah, that quite quickly we'll be able to so it won't take a whole year or 2 years to be able to say the impact, but so there'll be a kind of staggering of ones that will start to show an impact and we'll be able to say, yes, this is great, quicker, and then some that we'll have to really give it a bit more time to work through.
Yeah. And just thinking about recovery, some people will need to be in recovery long term. And that is good because we can keep them stable and keep an eye on them, have a look at what they need. Where we haven't got that in Luton, people are finishing treatment and then it's like they fall off the cliff edge because there's no support there for them. So what we're hoping is we'll see that, the people disengaging going down. So that will happen really, really quickly because we will be picking people up. So it's important to remember the clinical model is for a short time to get your drug and alcohol use under control. Recovery can be long term. And then the part in the middle, the support service, will kind of handhold you through all of those elements. But the other thing to mention as well is our current provider, if you go there now and you want some support, because they're tied up with a lot of these people that aren't really ready to change that or are unable to change because they're looking after them and they're very chaotic and they don't turn up to appointments. We've got people in Luton that want to get support and you have to really strike while the iron's hot when someone says, hey, I want to stop this. But we can't because we're kind of clogged up. So what will happen is next year there'll be a separation and the new provider will be working with those people that are ready to make changes. Then our support service will be taking some of those individuals out of that system and working with them in a different way until they're perhaps ready to go into the clinical model. So that will free our clinical model up to see people who are wanting to make changes immediately, so people will be seen straight away rather than having to wait.
Okay, thank you. I've got a couple more questions, so I'll say all together just in case I forget one of them. So first of all, when it comes to schools and sort of educational establishments, you were saying that that's an area to be focusing on. My concern will be a lot of these young people might be obviously have a turbulent home life because of the alcohol and drug abuse. Are we then further stigmatizing these young people, or how is that go? How is the support for those young people and the education for those young people not to fall into that trap of going down the same route in terms of drug and alcohol abuse? What are we going to do and how are we going to make it sort of a bit more kinder for them to access those services and the supports? So that's one question. Next question is, are we involving charities and our third sector in part of the recovery in terms of CBT and talking therapies, all of those kind of things that perhaps some charities offer? Are we going to be looking into that? And do you have a contingency plan if things don't go according to the timetable that you've got? And that's it from me.
Wow. Okay. So in terms of schools and education, and we currently do provide all schools in Luton with training programmes. We train all the teachers. There are lots of training that goes on and workshops and awareness sessions. We recently were at the big weekend, the BBC One weekend. So CGL, that young person service, are out there all the time at different events in all the schools, the PRUs. So they engage with the whole school, but they would also, if that young person wanted one-to-one support, either through their own misuse or because they were living with somebody, we've done lots of surveys with the young people, and it comes out that they really do know where to get support if it's needed, which is a real benefit. So they would be able to either go to the hub, which is in Castle Street in Luton, where we have a young person service that's open at the weekends, evenings and during the day, or they could have one-to-ones near where they live, because our current provider offers remote services out in the community, so young people can be picked up there. We are looking through the drug strategy at the moment, because pillar 3 in the drug strategy is all around that generational shift. How are we going to move these people on so that they're not drinking or taking drugs like their parents, because we know that it can run in families. So that's a whole priority piece of work that we're looking at the moment. But it's all about education, isn't it? And it's all about how you can get children to sort of have those ambitions to want a better life than what they've seen. So they're all the kind of things that we are doing currently, and they will continue, because we are commissioning an adult and young person service. In terms of what you talked about, CBT and types of therapeutic models, they would be within the clinical model anyway. That's available now in Luton, and we will be commissioning that moving forward. But we will be working with the third sector and voluntary organisations, both with the support model and the recovery model. We're expecting those two new parts of our drug and alcohol service to really interconnect with all of our different partners in Luton, depending on what that individual wants and needs when they come into that part of the service. So that real therapeutic element will be in the clinical model. In the support service and the recovery service, they will be working with the resources that are in Luton. I'm kind of foresee there being some kind of MDT meeting where we would be calling people in if that person has a mental health issue and looking at how we can link things up. Things are working really well in Luton at the moment, in partnership with the police, in partnership with adult social care, and in partnership with mental health and housing. You know, all the partners are working well together. We have a drug and alcohol board that looks at any issues and how we can improve things in Luton for people with drug and alcohol issues. And we're hoping to build on that because it's working really well at the moment. Did I answer everything there?
There was the bit about the risks that you haven't answered.
Yes, the risks. We're working with our legal team at the moment, so there will be contingency plans put in place. We will have a 3-month mobilisation period when we award the new contract, and we will performance manage the new contract as we've done, you know, with the current contract, with quarterly performance meetings. When we're in the mobilisation period, we will be meeting with the provider once a week. We have got a risk log with all of the things that we can think about that might go wrong, and we're trying to mitigate against them. It's not something we haven't done before, and the new model isn't too dissimilar to what we've got. It's just these two new aspects that we are commissioning to support the problems that we know we can see in Luton.
And the just one last point, just to add to what Sarah said. The new bit is a shorter term contract to test it, to allow for that evaluation. So that 2-year part is to manage that, so we can test, see how it works, and then just make a decision on what to do. The majority of it is longer term, but that new bit is shorter.
Thank you, Sally. I forgot to say all of that, didn't I? Yes, so we're looking at a 10-year contract as well, because one of the things that we know is drug and alcohol contracts need to be long, because it takes about 5 years for a service to really embed and get people to work with it. So our current one was a very short contract. So this time we're trying to learn from where our history and make it a longer contract. But the support service, because this is very new and a bit of a innovation that we've planned in Luton, we will be evaluating it to see what its what its impact is.
Just one last bit, if I may.
Yeah.
Just because it kind of fits in with something else. Sorry. I know Sally's laughing, thinking, oh God, not another question. It isn't a question, it's more of a suggestion. And I've mentioned this before in Children's Scrutiny Board, which is the one that I'm on. Have you thought of perhaps, because you talk about getting all the services to work together and all the different components to be able to make these people sort of integrate, I guess, into society quite successfully and stay away from the drug and alcohol? Because we're talking about children as well, and we're talking about integrating some of these services within schools and encouraging people and educating young people about all these issues, have you thought about perhaps bringing back the Strengthening Families, Strengthening Communities program, because that used to be a program that did run in Luton for a short while, quite a few years ago, when I was working with a charity called Changing Lives. That charity obviously has since ceased because of funding issues, but it is a program that kind of helps not just parents but young people as well, and it kind of reverses it on each other. So it kind of, when I see it as a good opportunity for both sides to kind of learn about each other's feelings and what each other are thinking. And it acts as a support really for the parent and the child when they are rebuilding those relationships, when they're going through rehab. It acts a bit like, I suppose, a bit of a talking therapy, a bit of drama therapy, and it's quite good and it's quite therapeutic. I found it to be quite successful, especially with the young people, absolutely loved it. And with the parents as well, it was quite successful because they're able to identify signs of when perhaps their young person isn't engaging so well and what might be going through their minds. Again, the young person gets to see things from the parents' perspective as well and what it's like for them. The fact that it is an illness, it's not that they don't care. So maybe something or a model similar to that might be something to consider for the future.
Yeah, I don't know whether Sally wants to talk to that one, but I would add that we have had conversation with the family hubs. We have had conversations with Family First, looking at how we can link in with this spec. But one thing to say is we already have a drug and alcohol programme for families and young people that's specialist for those with drug and alcohol issues, and it's called the Impact Service. Our current provider already offers that to families in Luton, and we will be taking that element and bringing it forward into the new spec. So that, as far as drug and alcohol treatment, is taking place now and will be continued.
Thank you.
Yeah, and I was just going to add that the Stronger Families, I think we called it here, was a national programme, wasn't it, with specific funding attached to it, which I think then stopped. But that model around whole family parenting support, seeing the family as a whole when they're in need or on the verge of being in need, I think was good. And as Sarah said, we are trying to think in that way where we can. So linking to Family Hubs, which has parenting programmes as well attached to it, and working in that way and linking the drug and alcohol services into Family Hubs. And obviously the bit that Sarah mentioned that the service already has that looks at family approach. But that Stronger Families was a particular funding stream that I just don't think we have anymore for that particularly. But that Think Families approach is definitely something we want to try and continue.
And I guess just one more thing to add, sorry, I feel like I'm taking up loads of time here. The recovery model that we are looking to build in Luton, I commissioned when I worked in Central Bedfordshire and Bedford Borough. And one of the things that we noticed was there was less people going back into treatment where you've got recovery. When you have worked with people with drug and alcohol issues, what I will always say is it's really easy to stop drinking or stop taking drugs. It's that maintaining it and getting through your life without starting to take drugs and alcohol that's really important. And that's why we need this independent service to work in Luton, so that we can stop that circle going round, which will impact onto your question that you've just was talking around, that generational drinking, so it doesn't continue. So in Central Bedfordshire and Bedford Borough, before I left, we've seen some really good results when we had the independent recovery, and we're hoping that we will see that in Luton. So there'll be less people stuck in drug and alcohol treatment, and more people getting back onto life, getting a job, getting back on with life, and leading a healthy life moving forward.
Thank you.
Thank you. Anyone else? Okay. Thanks very much, Sarah. I think all that detail you've given us, you've answered most of my questions as well. Just got a couple.
Okay.
Lot 2, you're talking about the lived experience and peer-centred intervention. Could you talk a little bit about peer-centred intervention and what that is all about?
Yeah, basically that is where we are employing people that have already had drug and alcohol issues in the past. They have moved through the treatment system and moved through into recovery, and now are working with people. We know from talking to people that they really like that kind of conversation with somebody who's been through the issues that they've been. We kind of call it, they're wearing the same T-shirt. That's why a lot of the outreach work that we do in the town centre will be with people who have had drug and alcohol issues in the past. So that anything that's to do with peer-led will be that it's people that are they see at the same level as they.
Can I guess if you have that sort of peer-centred intervention, and that's helpful to the peers who are giving that advice, do you find that it helps them to stay off their drug and alcohol habits?
Yeah, I think it does. There can be some issues because, as I said right at the beginning of my conversation, drugs and alcohol is something that, is a reoccurring condition. And when life throws things at you as it does, some people are able to cope. Some people will pick back up the bottle, or they will pick up the drugs and start using again. But the beauty of this model is the service would be able to help the peer worker if they felt that they were using again, because they will be really, really supported by the model and the work that they're in. So our current model has lots of peer workers, but they're given a lot of supervision and a lot of support to make sure that they are not taking on the impact and listening to people's problems too much, and it's having an impact on them, because there is some evidence that it can have an impact on someone if you're listening to their drinking problems and it's something that you went through. But hopefully moving forward, it's like volunteering, you need to take care of these people. So seeing as they're in the model, the provider should be able to, through supervision, take care of any issues that may occur.
Okay, thank you. So we're talking about evaluation of the contract. So the contract's for 10 years.
Yeah.
Presumably, you're talking about evaluation. So presumably the spec for the contract and the service agreements, whatever, they're not fixed. They can be adapted according to circumstances and what happens during the term of the contract.
Yeah, absolutely. The support model, the newest element, is just for 2 years, and we'll evaluate it to see how it works. The clinical model and the recovery model, which are staple drug and alcohol interventions, will be for 10 years, but there will be mechanisms in that we can pull the contract back or get involved. Our procurement department will get involved if there are any issues with that. So there is, we're working with legal at the moment, and we've got several clauses in there that will protect us.
And also there's the opportunity to flex if we think working with the provider, there's a need to do much more outreach than we're doing currently.
Absolutely.
There's opportunity to flex within the contract as well on that.
There will also be mechanisms in it that we don't know what future funding we will get. At the moment, we've got some additional funding from the drug and alcohol strategy, but we don't know what will happen with that in the future. So we've got mechanisms that if further funding comes down, we can actually move that into the contract and determine what we need from that without having to go through a re-procurement process and service level agreements. So it should be a lot smoother.
Okay, I think there's 3 lots that are going out for commissioning. Is there, and you were saying that there's the opportunity for different providers to do different parts of the service. Is there, I mean, how would you, is there a danger or a threat, a danger that you might have overlapping bids, or how do you decide which providers are going to do which parts of the service?
Well, we've had a lot of interest regionally and nationally already, and locally, so we know there's an appetite out there to come and work in Luton. So what will happen is one provider could say, Sarah, I can do all 3 elements of this, or it could be that 3 providers say we're going to do this separately, or providers come in and say let's work together and we can deliver the recovery element of it. Our intention is to hold 2 provider days where we will talk about the issues that we've got in Luton. We will provide data that we've got, and then we will talk about the new model, and then we are going to ask the providers to come back on another day and for them to give us feedback on how they would deliver that model. And then from that, we will pick the good bits out and have the detailed spec. So I can't imagine there will be overlapping, but I think there probably will be services that want to join together to deliver certain elements. We know in Luton we've got a lot of third sector and voluntary organisations. I think there will probably be the joining up of certain services, and they'll be bidding for the support service element and the recovery service element. I think the clinical model, we will probably be getting some of the national and regional drug and alcohol services coming down to bid for that, because we're just so near London, they'll want to sort of come out and having reach into Luton. So I don't see there'll be duplication, but there may be partnerships made wanting to deliver the model.
Okay, so it sounds quite flexible in the approach to it. Okay.
Yeah. Yeah. I was just going to say, we need that innovation. You know, we could sit and write an all detailed spec, but that's what we had before in Luton, and then one service can't deliver any, you know, all of that. What I would like to see is people coming down that are specialists in this area, of substance misuse, coming down to Luton and telling us what they're doing in their areas and what new innovation they've got, and then we will build those elements into our spec. So yes, it is going to be flexible. We need to hear what new ways of working are out there, because just having a drug and alcohol treatment service in Luton, we've had that for years, but we've still got loads of issues. We just need to think differently this time. So we're looking for innovation.
Okay, thank you very much. If there's nothing else, so I think we can support the recommendation as it's written in point number 2 of the report. So I think that's, yep, okay, thank you. Thanks very much, Sarah, for your very detailed report and your responses to the questions this evening. Thank you.
Thank you.
Okay, if we go on to item number 8, draft work programme. So it's been a long gap since the last meeting, and I think we probably need to revisit the work programme. So I think we perhaps need to have a discussion with the respective service directors and within the within the group about the forthcoming work programme. If anyone has any strong ideas about what we should be that's one of the things we need to talk about. Yeah. Okay, so if anyone has any thoughts about this, talk about it now, or you can raise that.
Sorry about that. Yeah, we were just saying for the 30th of July, 8 items, agenda items, especially written reports, is probably a bit too long for that. Any summertime, so many people might not be here as well.
Yes.
Yeah.
Okay, so shall we have a discussion with Democratic Services and perhaps the service directors as well about the best way forward to
Yeah, I think in following from the other months as well, from Nikki, there seems to be a report every month. Is that normal? Sorry, I haven't seen it from this from Nikki Polaine. So Nikki Polaine from ICB, she gives a primary care report. Is that supposed to be monthly, every meeting?
It is, but we can certainly discuss whether that needs to be at every meeting. We certainly should have that. I think we should have that at the next meeting because we haven't discussed those issues, primary care access issues, since February. So yeah, okay. So yep, we'll take that away. Okay, thank you. Okay, thanks.